Welcome to the Next Human. My name's Arav, and today I'm here with Professor Robert Langer, Institute Professor at MIT, head of the largest biomedical engineering lab in the world, the most headed engineer in history with over 400,000 citations, and one of the world's most celebrated inventors. Thank you so much for joining me today, Professor. It's wonderful to have you on, truly.
Thank you. It's a pleasure.
Awesome. So, I mean, the first thing I just want to ask is, can we just get a sort of brief synopsis of your life story, basically? What brought you to where you are today?
Well, I grew up in Albany, New York, and I went to the public schools and then Cornell University and then MIT.
Mhm.
And what I did then is I didn't really know what I wanted to do, and I ended up working in a hospital. I was the only engineer there, and that
Mhm.
gave me a lot of ideas about how to combine medicine and engineering, which I got my degree in.
Mhm.
And I did sort of some research that I like to think it was important, but a lot of people kind of ridiculed it. But I
Mhm.
felt it was really the development of the first kind of nano or microparticles that could release large molecules like a protein or peptide or nucleic acid like RNA or DNA,
Yeah.
using those things to help isolate the first blood vessel inhibitors of blood vessel growth, which would lead to a lot of drugs now that are used for treating cancer and certain diseases of blindness. And then I became a MIT professor in nutrition because
Yeah.
no engineering department would hire me. And actually I got off to a pretty rough start there. All my grants got turned down and they wanted to get rid of me, but I kind of kept at it and I'm still there. So that's kind of how I
So
got started.
awesome. Um, and I wanted to ask, you've done a lot of pioneering work in controlled release drug delivery, regenerative medicine, and tissue engineering. But I guess just I want to ask, how do you sort of decide on what next to focus on? I mean, I think I was reading a couple of years ago, your lab was working on developing uh, an oral application for taking insulin, and um, I guess it's just how do you decide what to focus on?
Yeah, well, basically, I like to think of things that hopefully will have a giant impact and change the world, and
Mhm.
can be what I'll also call, either a discovery that where we learn something fundamentally important or invent something, that could really create a lot of new opportunities.
Mhm.
But I
And
limit it to just that. Sometimes I want to do good, so like Bill Gates, for example, contacted me and asked if we could help develop new vaccines and better nutrition and other kinds of things based on the kinds of things we've done, but do
yeah.
this for the developing world. And I thought that was incredibly worthwhile. And, so I'm very happy to be involved and do that also.
And yeah, I think I mean I know there's uh a lot of numbers out there for how many ventures you've been involved in, and but I just wanted to ask you directly, how many companies do you think you've been a part of?
Well, I've probably been an advisor or probably several hundred. I don't know exactly, but hundreds.
Mhm. Awesome. And I just wanted to ask you specifically about Moderna,
Sure.
because just coming out of the pandemic, it's one of the biggest names out there. And I guess just how did the idea to pursue, mRNA vaccines come up? And I know there's a lot of distrust in the promise of them at the time. And I guess it's just what did you sort of see in the field?
Yeah, well, first, yeah, I thought protein vaccines and protein therapeutics were gigantic by the time we had started Moderna. I think it was, 14 of the top 20 best-selling drugs were proteins. I mean, and vaccines, of course, are very important.
Mhm.
It just seemed to me that when Derek Rossi came to see me and Nubar and he and myself and Ken Chen started Moderna, that and I had been an advisor to Genentech, which was a pioneer in protein therapeutics for 30 years. I just seemed to me like, well, you could do this much faster. You could you could take the guesswork out of things. For example, like with flu vaccine, you have to start like a year in advance to make it.
Mhm.
and you're guessing what it is, like H1N1. People may not realize it, but flu vaccine is like 40 to 50% effective. And it's part of it's because people are guessing.
Mhm.
Now, it seemed to me like, well, you could take a lot of the guesswork out. You could, and you are able to make the messenger RNA without cells, and which would give you all kinds of contaminants and stuff like that.
Mhm. And I guess like, do you think, I mean, what other applications like are you guys like thinking for mRNA vaccines? Like, I think I saw something about like potentials for HIV treatment, cancer, and research in rare disease.
All of those and many more. There's a whole big pipeline. It's public. I think, I think, some of the, I mean, cancer vaccines is something I think would be particularly exciting. Personalized cancer vaccines. I
Mhm.
think, RSV vaccines, flu vaccines. But then there's, they've got we've got vaccines for like Zika, for all kinds of things, and then like you say, for rare diseases,
Mhm.
cystic fibrosis. I don't think there's any limit to what mRNA
Awesome.
and Moderna and companies, in that area could do.
Awesome. Yeah, and I want to ask like, I guess I know you talked a lot about how having an impact is a big motivator in continuing your work. And I just like, is that your main motivation for like continuing to put out like all this prolific work? And I guess just like what else is on the horizon?
Yeah, well, impact is one. Training the best people. I like being an educator. I like working with graduate students and postdocs and helping
Mhm.
them. But things that I feel will have a big impact on the world, and then hiring great people that will help move it forward.
So, and yeah, I just want to like, could you touch on some like new um projects or stuff that's coming out of your lab?
Sure, sure. Well, we're working, I mean, in different things. Like one of the areas we work is in regenerative medicine. So one of my postdocs, we're collaborating with Li Wei Sai. We've made like these, what I'll call a brain on a chip, which I hope will, really be a whole new way of doing drug testing for neurologic diseases, like
Mm.
Alzheimer's and things like that. I mean, that's one kind of thing. We're working on new kinds of nanoparticles to deliver genetic information, like targeting them to specific cells that have never been targeted before, like heart cells.
Mm.
We're working on that with Dan Anderson,
Um,
a lot of others too.
awesome. And this is kind of sort of backtracking a lot in your actually a lot in your career. But I wanted to ask, like, I think I read somewhere that you sort of stumbled upon chemical engineering, like you uh weren't really sure what you wanted to do, and chemical engineering seemed like a good route for you to take. And I just wanted to ask, like, is there some point where, and then obviously, taking the chemical engineering background, you transferring it to bio, and did you at some point find, I guess, a passion for the field? Or is it always sort of you you like appreciated what you could do with it, and uh you felt you were good at it?
Well, I don't know if I was that good at it. I mean, I got into it. Really, I mean, I got into engineering because I was good in math and science in high
Mhm.
school, and my dad and guidance counselor said I should be an engineer. I really didn't know what an engineer did. When I
Mhm.
went to Cornell as an undergrad, my first year, the only course I was good at and liked was chemistry. So you had to choose. So I picked chemical engineering. You
Mhm.
know, I I mean, I got a good education, and I think chemical engineering is a great discipline for a lot of things. I didn't really do the conventional things that most chemical engineers have done, but I think it was a way of thinking, of problem solving, and a good background for when I would learn some things about medicine, applying it in new ways.
Mhm. And this is also kind of going back, but uh also, like, I think after you graduated, there was a lot of like, oil companies that approached you for jobs, and I think you've said that you turned them down because you wanted to do work that was meaningful. And I just wanted to ask, like, in your view, looking back now, do you think you've sort of made the impact that you were hoping to achieve?
Yeah, I mean, I think I have, though I have more I want to do.
Definitely, definitely. Um, and yeah, I think you, I mean, obviously, I think from your, there's always work to be done. I think you'd say.
Absolutely. I mean, there's more things that you can make the world a better place, so you try to do
Mhm.
that. And more young people in the lab that I hope we can, um, you know, um, yeah. So absolutely.
Awesome. And yeah, I mean, it's a perfect transition because my last question here is just kind of as someone who's had, such a pioneering career in biotech and chemical engineering, like what advice would you give to aspiring professionals, researchers, or students who are, looking to make contributions in the field?
I'm not sure I fully understand the question.
Uh, in just sort of like what is like one piece of advice you'd just
Oh,
give
well,
to them.
I guess if then what I would just say is, for advice, I always tell people to dream big dreams, dreams that can change the world. I think if you do that, it's not easy. You're going to probably run into a lot of opposition, and
Mhm.
I usually say, and maybe a lot of criticism. And I usually say, don't give up easily. Don't give up, or at least don't give up easily on those dreams.
Awesome. And I guess that's you'd say that's you mentioned like some rough patches that you went through, and I guess that's what you were sort of clinging onto to not give up.
Yeah, I think that's probably right. It's easier to look back now, and when you're going through it, it's not so pleasant. You get sort of sad and depressed, but you keep trying.
Awesome. Well, thank you for taking your time and sharing your story and your work. I mean, it was wonderful to have you on.
Well, thank you. You did a very good job. Excellent questions. I wish you the very best.
Thank you. Thank you. All right. Have a great day.
You too. Thanks again.
All
Bye.
right. Bye bye.